Refractory angina is a painful and debilitating chronic condition that has a severe impact on a person's life. Shockwave Medical have developed an innovative device called the Reducer that is placed in a vessel outside the heart through a short procedure and has the potential to help improve quality of life for millions globally suffering with the condition.
Deepak is in his 80s. Despite a niggling hip problem, he can walk up these stairs. But it wasn't that long ago that climbing these steps brought on symptoms that felt like a heart attack.
When I come up the stairs to the garden, there suddenly starts tightening of the chest and acute pain. And sometimes referring to the left arm, so I know there's a cardiac pain.
He had refractory angina, a chest pain caused by an inadequate blood supply to the heart, which feels like pressure or squeezing in the chest or pain across the body. For the majority of people, their angina is treatable, but for others, like Deepak, it's severe, long-lasting and cannot be controlled by traditional treatments.
It's often people who've gone to the end of the road with all the conventional treatments. So they may have had lots of angioplasty and stenting procedures. They may have had coronary artery bypass surgery. They will be on extensive medication, lots of anti-anginal medications. But despite all of those treatments, they've still got symptoms.
I want to see three hospitals and top cardiologists, and they all say they can't do much for me. I'll have to carry on with my medicine.
But then Deepak met Dr. Hill. He suggested a procedure using NICE-approved technology called the Reducer. It's a small hourglass-shaped device implanted into the main vessel that collects blood leaving the heart muscle. It creates back pressure that increases blood to areas of the heart not receiving normal flow, reducing the symptoms of angina. It can be fitted in half an hour under local anaesthetic. Dr. Hill has been using this technology since 2013.
A significant proportion of those patients now, and I'm still in touch with many of them, have no symptoms at all. And so it's been an absolute transformation in their daily lives, that they can go out for walks, they can play with their grandchildren, some of them have gone back to work. So it's a life-changing procedure for many people.
Before the procedure, exertion caused Deepak chest pain, forcing him to rest.
This is the hill right outside your house. It became a huge problem for you, didn't it, trying to get up here? But now you can get up here.
I can get up and don't have any pain or anything.
How amazing.
Yeah, it's lovely. Feeling lovely for that.
Dr. Ranil De Silva is a cardiovascular consultant at Royal Brompton Hospital in London, a world-leading centre for refractory angina.
The Reducer has mainly been evaluated in patients with advanced coronary artery conventional coronary artery disease. And for that, we've seen that it is a significant game changer, with 3 out of 4 patients improving their symptoms of angina and quality of life as a result.
It's estimated that almost 2 million people in the UK have or have had angina. Refractory angina accounts for 5 to 10% of them. Receiving the right treatment takes pressure off the NHS.
We know from other studies that patients have reduced hospitalisation visits, healthcare costs are reduced, exercise capacity increases. So all the things that are important to patients seem to improve after Reducer implantation.
If you're a patient who has still got very significant symptoms, speak to your cardiologist and mention to them that there are now 15 Reducer centres in the UK, and just ask to be referred to one of these centres to be assessed.
Deepak and his wife have been married for 54 years. For them, it feels like life is blooming once again.
It is more than 1.5 years I have this, and I never had any angina after that. I'm not scared of anything now.
How does that feel, not to have anything now?
What do you think I should feel? Free.
Free?
Free. Feel free.